Welcome to Joint Camp via video link. The orthopaedic booking clerk will have sent you the video link in preparation for your upcoming surgery. During Joint Camp, we tried to advise you what to expect before you have your surgery, when you have your surgery, and after your discharge from hospital. We have several speakers talking to you today. There's myself, who's a nurse. We have a physiotherapist, occupational therapist, and social worker. My name's Nora Johnson. I'm a staff nurse on Ward 1. Ward 1 is the orthopaedic ward at Whangarei Hospital. I'm going to go through what you hopefully have or should have received before you come in for your surgery. You should have a brown envelope. This was given to you by the pre-assessment nurse. On it, she will have written your name and any other information that's important for you before you come in for your surgery. That includes any medication that you're not to take the day of your surgery, which could be a blood pressure tablet, or it might also include diabetic medication you're not to take on your day of surgery, and also any blood thinners that you have to stop before your surgery. Inside this pack is information for you to read about your upcoming operation. If you can open the pack, have a good look inside and read it. There's information about anesthetics, which is an important one for you, as well as other important information. So please go through this pack before you come in so that you're familiar with this information. Also, you should have received a plastic envelope like this. Inside is more information for you to read about having a total hip replacement. There's a book 1 for a total hip replacement, which is here. We drip feed you information. You'll also be given or sent a book 2 by the orthopaedic booking clerks. Important information that helps us help you when you come in for your surgery is a yellow discharge planning form and a home environment questionnaire. If you could fill these in and send them back in a self-addressed prepaid envelope. That's information that helps the occupational therapist, physiotherapist, and social worker. You'll also have been sent a chlorhexidine impregnated sponge and some information on how to use it. We ask that the night before your surgery you shower yourself with this, shower all over, get all your nooks and crannies, wash your hair as well. Stand for 2 minutes and then wash it off. This is to help get rid of bacteria on your skin and on your hair, because we want to make sure that you have a seamless journey and help to prevent any infection. Just remember that this can be a bit slippery in the shower, so don't slip, please. So the information on that is here. After you've had your shower and dried yourself, we ask that you get into clean pajamas or night clothes. If you don't wear any, maybe change your sheets that day. When you come in for your surgery the following day, you'll be given some chlorhexidine impregnated wipes to wipe yourself down with before you get into a hospital gown, similar to this one, which you're probably all familiar with. You'll also put on our hospital knickers. So you've wiped yourself down, you're in the gown. We also like to then insert up each nostril a betadine swab, because we have bacteria in our nose. Just make sure that you let the nurse know before this is done if you have an allergy to betadine or iodine. When you're sent the chlorhexidine sponge, you should also have been sent a book 2 for a total hip replacement. And the information that we tell you on this video is also included in the books. You get a book 3 when you're discharged from hospital, and it's the physiotherapist that gives that one to you. This is your joint journey. Everyone started at number 1 at your GP. We're now at lucky number 13, joint camp. Number 14 is when you come into hospital for your surgery. So look after yourself. Keep yourself wrapped up in cotton wool. Don't get any cuts or scratches, coughs or colds. If you have a cut or an open wound, the surgeon will not operate on you. If you have a cough or cold or sore throat, they won't operate on you either. So stay away from anyone who might be unwell. Tell them you still love them, but you don't want to get sick from them. So that's the paperwork and what you should have received before coming into hospital. Your orthopedic booking clerk will ring you with your date and time of surgery. And they'll also inform you which hospital you'll have your surgery in. It could be at Whangarei Hospital, it could be Kensington Hospital, or it could be Kaitaia Hospital. If you're at Kensington Hospital, your surgery comes under the Northland DHB umbrella. Your surgery is paid for and you have 3 nights stay paid for as well. If you are needing a bit more than the 3 nights, you may transfer to the hospital closer to where you live. If you're advised to come in at 7 o'clock in the morning, it means your surgery will be in the morning. So you're to fast from 2 o'clock in the morning, nothing to eat or drink after 2, although you can have a glass of water at 6 o'clock in the morning when you can take your medication. But obviously don't take the medication you've been advised to not take on the morning of your surgery. If you're told to come in at 11 o'clock in the morning, you can have a light breakfast and have a cup of tea and take your usual medication. Once again, don't take the medication you've been advised to not take on the day of your surgery. So you can, after 6 o'clock, you're not to have anything to eat or drink, apart from a glass of water at 9 o'clock in the morning. It's a good idea if you do have that glass of water then, because with your surgery in the afternoon, you don't want to be too thirsty while you're waiting and fasting for your surgery. So at Whangarei Hospital, you need to present to SAU or Surgical Admissions Unit. We have the main car park down the bottom, which is a bit smaller now because we have built some more theatres there. You have the next level up, which is SAU or Surgical Admissions Unit. If you go to the 3rd level, that's the main entrance, and you've gone too far. So if you present to SAU on the date and time of your surgery. Kensington Hospital, it's on Kensington Ave in Whangarei. Just present yourself to reception and they will show you where to go from there. And Kaitaia Hospital is the same, to present yourself to reception and they'll direct you where to go to get ready for your surgery. So in SAU, we put your belongings in your bag. Your bag gets taken up to Ward 1 where we store it in a locked cupboard. We prepare you for your surgery. Remember, you get wiped down with those chlorhexidine wipes. Then you get into our hospital gown and our hospital knickers. You'll be fitted with compression stockings. You're measured for these so that they fit you correctly. What's great about them is they have little grippy bits at the bottom, so when you do get up and walk, you're less likely to slip. But wearing these compression stockings helps prevent what we call a deep vein thrombosis or DVT. So from SAU or Surgical Admissions Unit, or from where you're prepared for your surgery in the other hospitals, you'll go into a little anaesthetic room where you meet your theatre nurse, your anaesthetist and your consultant. So if you have any last minute questions, this is the time to ask them. If you have a question between watching this and when you come in for your surgery, write them down in book 2. There is a page there with lines on it, because the last thing you'll remember when you come in is the questions that you have now. There are 2 types of anaesthetics. There's a general anaesthetic, where you get knocked out and put to sleep, and you wake up in the recovery room. Or there's a spinal anaesthetic, where the anaesthetist puts a cannula in your back, and you get numbed from the waist down. You get sedated, but you can often still hear what's going on. So it might be that you have a preference of one or the other anaesthetics, or your anaesthetist says that one or the other is preferable for you because of pre-existing medical conditions that you have. So it's a general anaesthetic, a spinal anaesthetic with sedation. Sometimes they'll do a combination of the 2 of them. A total hip replacement normally takes 1.5 to 2 hours. The incision is down the side of your hip. Sometimes it's a little to the front, called an anterior approach. or to the back, which is a posterior approach. I talk a bit more about the posterior approach because that's the approach where you do have some precautions after your surgery so that you don't dislocate your nice new hip. So the surgeon cuts down the skin through the muscle and gets to the bone. They then cut the top of your femur off. They put the femoral component down the shaft of your femur. Doesn't go in quite that easy. There's a little bit of banging that goes on. The other half of a total hip replacement is this little cup. Goes into your acetabulum or into your pelvis. And that gives you a nice new total hip replacement. This is a mismatched pair, but it's just an idea to give you idea of what a total hip replacement looks like. In some cases, the stem is solid, goes down the shaft of the femur, and is held in with surgical cement. Sometimes it's a little bit porous, they're tiny little holes, goes down the same way, but we wait for the bone to grow to hold it more firmly in place. So you can ask your surgeon which they're going to use for you, cemented or uncemented. So a total hip replacement is very similar to your own native hip. It's a ball and socket joint. But being an artificial hip, it does have some precautions. Having a new total hip joint replacement, you do have some precautions. If you stress that joint past its comfort zone, it can dislocate. So there are 3 precautions, and it's important that you adhere to them for the first 6 weeks to 3 months following your surgery. But you do have to bear in mind, you probably have to be careful for the rest of your life because you've got that nice new hip joint for the rest of your life. The first precaution is to avoid crossing your legs. It doesn't matter how you're sitting in a chair, you don't want to be crossing your legs at any angle. Also, the time will come when you're at home and you want to lie on your side, put a pillow between your legs so that your legs don't cross over when you're lying in bed. When you're in hospital and we roll you, we always put a pillow between your legs to prevent your legs crossing. The second precaution is to avoid twisting. So if someone talks to you from behind, pick your feet up, little penguin steps to turn around and talk to them. And the third precaution is to avoid bending your hip past 90 degrees. Imagine this is a chair and you're sitting in it. You should sit in a chair where your hips are slightly higher than your knees. If you sit in a lazy boy, which is out for you, I'm sorry, your hips are lower than your knees. You then bend forward to stand up and you're likely to dislocate your hip. So these 3 precautions are important for those first 6 weeks to 3 months following surgery. A good way to remember about not twisting is that you keep your nose and your toes always facing in the same direction. So if you're getting in and out of bed, don't twist that leg to bring it round. If you're getting in and out of a car, don't twist that leg to get in and out of the car as well. So you've had your surgery, 1.5, 2 hours later, you'll wake up in the recovery room. You'll stay in the recovery room maybe 2 hours, maybe a little bit longer. They like to keep you there until your condition is nice and stable and your pain is under control before bringing you up to the ward. You'll have lots of things attached to you when you wake up in the recovery room. You'll have oxygen. It might just be nasal prongs that we gently blow up each nostril. It's more likely to be a Hudson mask. Feel like an air hostess, but it won't drop out of the ceiling. When you're a little bit more awake and stable, we put the nasal prongs on because it's easier for you to eat and to drink and to talk. You'll have an IV line in. We give you intravenous fluids. We also give you 3 doses of intravenous antibiotics over the first 24 hours following your surgery. That is routine practice, and it's what the consultants prescribe. I'm going to turn on a machine because you do have several machines attached to you, and they all have an alarm if they're not working properly. So if you're lying in bed and all of a sudden an alarm goes off, don't you be alarmed because you've done nothing wrong. Just ring your bell and call for your nurse. So I'm going to turn this pump on. It might take a little while to warm up, but hopefully you'll hear the alarm. But I'll keep on going. There are different types of pain relief. Oh, there we go. Can you hear that? It's warming up, and that's the sound that it makes when something's not right. So give your nurse a ring on your call bell. You've done nothing wrong. Turn it off. So there are different types of pain relief that your anaesthetist may have prescribed for you following your surgery. And in this case, this would be attached to you once you leave the recovery room, coming up to the ward. It's a PCA, or patient control analgesia. The anaesthetist has prescribed the medication. It's usually morphine, but not everyone can take morphine. There are other stronger pain medication like fentanyl that the anaesthetist may have prescribed. As nurses, we fill in the prescription and we enter it in the computer. You will get given this button. The green light will be on. So when you have pain, you can push the button. When you push the button, the green light will flash at you, which means you're giving yourself pain relief. The green light then goes off. You've given yourself pain relief. There's always a time delay of about 5 minutes until the green light comes on again. So if you still have pain, you can push the button and give yourself pain relief again. You'll be asked many times when you're in hospital, what is your pain score out of 10? Think of a line between 0 with the numbers up to 10. 0 is no pain, 10 is the worst pain. We try and keep your pain at 3 to 4 out of 10 while you're in hospital. There are times when it will go up to 7 or 8 when you move or when we roll you, but we do aim to keep it at 3 or 4 out of 10. So you can help yourself with this PCA or patient control analgesia by pushing the button to give yourself pain relief. You can only give yourself a certain amount every hour, and we do keep a close eye on you because not everyone is used to having strong medication for pain. If you don't have a PCA, you may have an epidural. The anaesthetist has put a very fine little cannula. It's very fine and pliable. They put that in the epidural space in your spine. It gets taped up your back, and the filter is taped to your shoulder. It drips continuous pain relief. Once again, we keep a close eye on you. We ask you, what's your pain score out of 10? We also like to run ice up and down your sides. Where it's icy cold, there is no block. Where it's a dull cold, there's a block, and that's where pain relief is working from. At times, if the block gets a bit high, we might have to stop the infusion for half an hour, or if it's a bit low, we might have to give you a bit extra. So we like to keep a close eye on you. With an epidural, you might find that your legs are a little bit heavier or feel a little bit different because the pain relief does go down to your feet. If you don't have a PCA or an epidural connected to you, you may have had what's called intrathecal morphine. The anaesthetist has put some morphine into the intrathecal space in your spine. That can last some people for 12 or 24 hours. You might only need tablets to help with pain. Some of you may need to be connected to a PCA. So with the epidural, that's only done here in Whangarei Hospital. They don't do this use it in Kensington or in Kaitaia. So you have your drip connected to you following when you're in the recovery room. PCA maybe an epidural. You'll have oxygen on. You may have a urinary catheter. We like to keep a record of your urine output, make sure that your kidneys are functioning. And if you do have a catheter, you don't need to worry about getting up to the toilet that first night. But we do generally take it out the following day. You'll have compression stockings on to help prevent a blood clot or DVT in your leg or legs. You'll also have a foot pump. This machine hangs off the foot end of your bed, and this pump is attached to your foot. So it blows up and gently flicks your feet to help with circulation. Also to help prevent a DVT. The best thing that you can do though is actively move your ankles up and down because you're using the muscles in your calf and you're pushing the blood back up to your body. So while you're doing your ankle exercises, it's a good idea to start clenching your quad muscles, pushing your kneecaps into the bed to help the circulation. Clench your buttock muscles. I know you've had a hip replacement, but you can certainly try and clench the other side to help the circulation. And you are lying in bed a bit after your surgery. While you're doing your ankle exercises, deep breathing is important. You've had either a general anaesthetic or a spinal with sedation. And when you wake up, you're only going to use the top 2 lobes of your lungs. We have 5 lobes. 1, 2, 3, there's a middle one on the right side. 4, 5, your bases at the bottom. And you're lying on them, so you're not going to be using them. You're at risk of developing atelectasis, which is when your lungs collapse, and that can make you very sick. You're also at risk of developing pneumonia or chest infection because you have secretion sitting at the bottom of your lungs, causing an infection. So deep breathing is really important following your surgery. We'll do some deep breaths together, and then we'll do a cough after the 3rd one. Something that you can practice when you're watching telly and maybe when the ads come on. So a slow deep breath in through your nose, hold, and out through your mouth. And again, slowly in through your nose, hold, and out through your mouth. And one more time, slow deep breath in, go as deep as you can, hold it a little bit longer, and a huff out. And then give a cough. So you're expanding your lungs, and then the cough is helping to shift any secretions that might be sitting there. So you're helping yourself in your recovery. I've talked about getting a DVT or deep vein thrombosis, atelectasis or chest infection. You're also at risk of developing a pressure sore on your heel. The leg that's been operated on, you may not be able to lift that heel off the bed. It may sit very heavily on the bed. Certainly after a spinal anaesthetic, you won't have feeling until the spinal wears off. And with an epidural, if you have one, your legs might feel a bit heavier as well. So we put a pillow under your leg, lengthways. Your body's up here, and say this is your heel. We like to have your heel just sitting over the edge. We like a floating heel, so you don't get a pressure sore on your heel. You can do the same when you go home from hospital. Put a pillow under your leg when you're resting. If your other leg, the heel is also starting to burn or go numb, please let your nurse know. We'll put a pillow under that leg as well to keep the heel off the bed. A pressure sore can form in 20-25 minutes, and it can take weeks or months to heal. So prevention is far better. So you've had your surgery, you've been in the recovery room, you've got all this attached to you. When you're stable, the recovery nurse brings you up to the ward, and this will be the same in all the hospitals. On the ward nurse then continues with your care. We keep a close eye on you. We'll do your blood pressure frequently, check your wound for ooze, make sure you're doing your ankle exercises, keep checking your heels, making sure they're free off the bed. We also like to wash and roll you, to check your back and your sacrum to make sure that there are no pressure points. And this care continues into the night, so you won't get a lot of sleep that first night. Do bring in a bottle of pump water with you. We have cups and glasses of water, but by the time you're half lying in bed trying to drink from a cup, it might end up down your front. Whereas if you bring a bottle of pump water with you, you can sip away, close it off, and leave it in the bed with you, and we can refill it with our filtered water. So day 0 is day of surgery. That we don't count the day of your stay until the following day, which is day 1. So day 1 after your surgery, you'll meet your surgeon. So if you have any questions to ask, that's the time to do it. You'll meet your nurse, you meet your physio, might be a healthcare assistant. We have them here. I don't know if they have them at Kensington or in Kaitaia. We'll give you breakfast. If you feel a bit sick, let your nurse know. We can put something in your drip to help prevent nausea. Do drink fluids, do drink water, even if you don't feel like eating too much. You need to keep hydrated. After breakfast, we'll give you a bowl so you can wash and freshen up what you can reach. And we'll come and help wash your legs and your feet, because remember, you won't be bending forward past 90 degrees to do that. We also will wash and roll you, change your sheets, wash your back. We make a time with our physio to help get you out of bed. So we show you how to get out of bed, to sit on the side of it. You might be a bit dizzy, that can be quite common. We wait until that dizziness goes, and then with the help of a walking frame and the physio's there, we help you to stand. We encourage you to take a few steps on the spot. If you feel okay, you might even go for a little walk and then come back to bed. If you still feel a little bit dizzy, we'll probably just take a few steps on the spot, maybe up the bed a little bit, and help you back into bed. That's sort of what we expect of you on day 1. But if you've done quite well, you may get up again in the afternoon. You may even get out in your chair for dinner. But once you're back in bed, sip on your water, do your exercises, have pain relief, and rest. The next day is day 2 following surgery. You may have lost your PCA and gone on to tablets for pain relief on day 1, or it may not be until day 2, the same as with the epidural. But certainly on day 2, we stop the PCA, epidural, and get you onto tablets for pain relief. In the morning, we help with the physio's help. We get you up with a walking frame, make sure your head's in the right space, walk you across to the toilet and shower. We give you a hand to have a shower. We have shower stools for you to sit on. And then we help you to get back to bed. We encourage you to get dressed in your own clothes. So you need to bring in some nice old baggy clothes, no Gucci labels in case you get a little bit of blood on them. And do make the effort to get dressed, because you have to learn how to get dressed. How can you get your trousers or your knickers on following your total hip replacement without going past or breaking your precautions? And we have staff 24 hours a day, 7 days a week to help you. Also on day 2, we encourage you to sit up in your chair for meals. The physio will come and see you. They might get you walking on elbow crutches and walking up and down the corridor. And it is nicer to be in your own clothes and not in one of our hospital gowns that blows open at the back. The following day is day 3. We aim for discharge anywhere from day 2 to day 5 following surgery. Some will go home on day 2, some will go home on day 3, 4 or 5. We aim to get you up and get you moving so that you can go home and continue your recovery in your own home, in your own environment. So you do need to have a good discharge plan, which is why I mentioned earlier about sending in the yellow discharge planning form, sending that back into hospital for our social worker to see if you have any issues or concerns about a discharge plan. We do advise that you obviously need someone to drive you into hospital because you won't be driving home. You need someone to drive you home. You need someone who can drive you to your physio follow-up appointment, which is usually 3 weeks after surgery at the hospital closest to where you live. We also advise that you have someone with you for the first 2 weeks following surgery, particularly at night time. The social worker will see you when you're on the ward, and they'll ask you if you need any help, maybe with personal cares, showering, but we don't have the facilities to provide people to stay overnight. So you do need to have plans for someone that you know, family, friend, could be several friends, to stay with you at night time. It's at night, when maybe you've overdone it during the day, that you get up to go to the toilet, and you can't quite get your leg up out of bed, and you can fall. You don't want that, and we certainly don't want that. So you need someone at night with you in case you need them, so you can call on them to help you get that leg out of bed so you can get to the toilet without incident. When you're discharged, you'll be given a discharge letter that the doctors have written. You'll be given a prescription for pain relief. You should also get a prescription for laxatives, because all the pain relief that we're giving you in hospital, your Sevrodols, your Tramadols, all your stronger pain relief, they have a very common complication: they constipate. That's a very personal thing, and you'll think, oh, I can sort this out when I go home. It's not something to sort out when you get home. From when you come up to the ward from the recovery room, we should be giving you laxatives in the morning and in the evening. So when you are getting up, walking to the toilet and shower, your bowels start working. So when you go home, you'll still need the stronger pain relief medication, so make sure that there are laxative charted as well. On the ward we do have Kiwi Crush, which can be a good laxative. You can buy that at the supermarket in the frozen section. For some people they use prunes. Everyone has their own different remedies. But make sure that you are taking enough laxatives so that you're not getting too constipated. If your bowels haven't worked for 4 days while you've been on the ward, you'll probably need an enema to help you. At joint camp, I normally advise people to make sure that their bowels are working the day before their surgery, if not the morning of. So by the time you're getting up, walking to the toilet and shower, that your bowels are starting to work. So on discharge, you get your discharge letter and prescription. District nurses aren't going out to see people like they used to. They don't have that capacity now. So we advise that you make an appointment to see your GP or GP nurse to check your wound. When you go home from hospital, you'll have an op-site dressing, a fairly light dressing on your wound. It is waterproof. Don't try and drown it in the shower because otherwise it will leak. But generally it's a waterproof dressing. If there's been no ooze on it from when you've had your surgery, we leave that same dressing on. We don't change it. If there has been ooze while you're on the ward, we will change the dressing at the doctor's request. There are different ways that your wound will be closed depending on what your surgeon has used. You might have staples. They need to be removed 10 to 14 days following surgery. You may have dissolvable stitches, in which case the top and the bottom of the stitch might need to be nicked off or cut off. Or if you're at Kensington Hospital, they often use a dressing that stays on for 2 to 3 weeks. It's like your wound is glued and the dressing falls off on its own. But it's important that you make an appointment to see your GP or GP nurse. 10 to 14 days following surgery to have the wound checked by a medical person or by a nurse and get the dressing changed and any clips out that need to be removed. As with any wound, you can get an infection. If you think you have a wound infection, we ask that you ring Sharon Ota or Gavin Shirley. Their numbers are on the back of book 2. They work during normal working hours, Monday to Friday. If it's the weekend, after hours or public holidays, we ask that you go to your nearest emergency department. The doctors there can have a look at your wound and they can liaise with the orthopaedic team that would be on call at Whangarei Hospital. There's always a team on call. We don't want you going to see your GP or going to White Cross. You have to remember that wound goes down to your bone. And if you have an infection there, you need to maybe have a blood test or a sample taken from the wound before you might be started on antibiotics. If you go to your GP or White Cross, they might look at your wound and say, yep, you might have an infection, here are some antibiotics. We then can't do the test to see how deep the infection is. So please go to the emergency department closest to you on weekends, public holidays, or after hours. Before you're discharged from hospital, the physiotherapist gives you book 3. In book 3, there are instructions on when you can drive again following your surgery. But I do advise that you ask your surgeon before you leave hospital when you can drive. It varies whether you have a car with a clutch and if you've had a left total hip replacement or a right total hip replacement. So speak to your surgeon and also have a read in book 3 because that will tell you when you can drive. A couple of other things. While you're on the ward following your surgery, you may receive an injection called Clexane. It's a slightly stronger blood thinner. It goes into your stomach and it feels like a bee sting. When you're discharged from hospital, some people may need to have Clexane, which they need to self-administer when they go home. it's more likely that you go home on aspirin or a tablet called rivaroxaban, which you normally take for 4 to 6 weeks following surgery. Some of you may be asked to have a blood test called a group and hold. This is in case you need a blood transfusion following your surgery. The booking clerk will advise you if you need to have a group and hold done. It's a blood test that has to be done at the hospital nearest where you live. It lasts a maximum of 21 days. It doesn't mean that your blood type changes in that time, but you may get antibodies in your blood. So we ask that it's done 7 to 10 days before your surgery. That way it's still valid for on your day of surgery as well as your 2 or 3 days following your recovery. You also have this card in your plastic pack. It's the orthopedic implant verification card. Once you've had your surgery, we ask that you fill in the other side with the details. What date you had your surgery, what you had done, where and by whom. Keep it in your wallet. If you're lucky enough to fly overseas, you'll set the alarms off at the airport. They'll probably put the wand over you, even though you can flash your wound and show your card. The other reason to keep it in your wallet is if you're unlucky enough to be in a car accident or to collapse and be unconscious, once the ambulance driver stabilizes you, they go through your wallet to see who you are. If they come across this card, they know that you've had a replacement. It's also important to let any medical person or dentist know that you've had a replacement. If you're needing dental work done, you may need to go on antibiotics. Now, just a little bit extra and a little bit of a recap. Stay fit and well. Wrap yourselves in cotton wool. If you do happen to get a cough or a cold, feel unwell, or have a sore or broken skin, please let your booking clerk know. We may have to plan your surgery out. We don't cancel it, we plan it out until you're fit and well. Don't do anything that you can cut yourself with. Don't go cleaning the spouting, pruning those roses, even mowing the lawns where a stone can flick up and damage the skin on your leg. So wrap yourselves in cotton wool. Remember to post in your home environment form and your discharge planning form. Make sure you have a good discharge plan. A good discharge plan is really important. That you have someone at home with you for those first 2 weeks following your discharge, and you have someone to stay with you during the night. If you have concerns, you can contact a Ward 1 social worker, and you'll be hearing their talk as well after mine. If you live alone, contact the social worker to see what supports can be put in to help you so that you can get on and have the surgery done. Make sure you bring your own medication in with you. We do take them off you, put them in a green bag, which is labelled and stored in our medication room. After your surgery, you may not need your blood pressure tablets for a day or two while your body's adjusting following surgery. Having a total hip replacement is fairly major surgery, but we do get you up and we get you moving and we get you home again as quickly as we can. Remember to withhold any medication that you've been advised to withhold before your surgery. We advise that you quit smoking. If you're having problems quitting smoking, you can see your GP to get patches and gum or lozenges. We also advise that you quit any alcohol intake at least a month before your surgery. Research has shown that if you continue drinking and you suddenly stop it before major surgery, you're more likely to suffer from hallucinations, delusions, and confusion. And that's not pleasant for you or for anyone else around you. We ask that you withhold any herbal medications for 2 weeks before your surgery. They include your glucosamines, chondroitins, turmeric, magnesium, fish oils. The surgeon wants those out of your system before they operate on you. After your surgery, you can continue taking them again. You may have to have a blood test called a group and hold. The booking clerk will advise you about that. If you're concerned that you have a wound infection, you need to ring Sharon Ota or Gavin Shirley, and their numbers are on the back of book 2. You should receive a follow-up appointment to see your surgeon. It's normally 6 weeks following surgery. Just make sure that you do receive it. Circle in your calendar the date the month after your surgery. If you haven't heard by then, you can ring the orthopedic department, the outpatients department, and check where your follow-up appointment is. The surgeon likes to see you. They like to take an x-ray of your new hip as well. So I wish you well for your surgery. Hope you have a seamless journey. All the best. Thank you.
Hi and welcome to Joint Camp. I'm Carl, I'm one of the physios here at Whangarei Hospital. Today I'm going to talk to you about what happens after your hip joint replacement surgery and how physio is going to be involved in your recovery and rehabilitation. So I'm basically going to run you through what happens each day after your operation and what the physio sort of expects. I'm also going to try and answer any of your questions that you've got and hopefully alleviate some of the anxiety about having your surgery. So we've found that it's best practice to try and get you mobilising or up and walking as soon as possible after your operation. This helps reduce any risks of further complications like blood clots, respiratory tract infections, and it helps your digestive system to get back working after the anaesthetic. We're going to be there every step of the way to help you along, but it's also really important that we try and get you to do as much as you can for yourself as quick as possible. We're obviously going to be there if you need a bit of help, but we're going to be trying to encourage independence. Now, what we do is we call your day of your surgery day 0. It's normally a pretty cruisy day for yourself. You turn up at the time that your surgery, or you've been told to come for your surgery, hop on the operating table and let the surgeon do their thing. What we try and ask you to do after your operation, as soon as you wake up, is give everything a bit of a wiggle. It's quite unnatural to stay still, so what we like you to do is give your ankles a bit of a wiggle, wiggle all your fingers and toes, give your leg a bit of a shake. And I'm going to run you through 3 exercises a little bit later on that we'd like you to start doing. You generally won't see a physio on day 0. There are exceptions to the rule. If you are first on the list, we may come and see you in the afternoon, depending on how you feel. But everyone's a little bit different. Day 1 is generally when most people will see a physio. We'll come in the morning with your nurse, we'll check how you're going, we'll run you through the bed exercises to make sure you know how to do them, and then we'll try and sit you up on the edge of the bed. It's not unnatural to sort of feel a bit nauseated or a bit dizzy the first time we sit you up. So we just take it a bit easy and see how you feel. If you do feel quite good sitting up, we'll try and stand you up with a walking frame. And same thing again, if you feel a bit nauseated or dizzy, we take it easy. If you do feel good standing up, we can go for a little bit of a walk in your room. The walking is not a necessity on day 1. However, it is quite nice just to get up and moving. Day 2 is when we start trying to progress your walking a little bit further. We try and get you to and from the bathroom with a walking frame. Some people feel really good and can jump onto crutches on day 2. Everyone's a little bit different, and we'll just sort of play it by ear on how you feel. We'll encourage you to keep doing your bed exercises and keep moving around. If you've got your own clothes in hospital, we'll try and get you dressed in those and sitting you out in the chair for all of your meals. Day 3 is generally when we start talking about going home after your hip operation. But to do that, we need to be able to do 3 things. We need you to be able to get in and out of bed by yourself. We need you to be walking independently with a walking aid. No one gets discharged without a walking aid, so some people go home on a walking frame or elbow crutches, or some people even go home on both. We also need you to be able to go up and down some stairs if you've got some at home. So if you've got 10 steps at home, we'll take you up 10 steps. Even if you don't have any steps, it's often a good idea just to practice some in case you go out anywhere in the community with steps. We'll also set you up with a home exercise program so that you can keep progressing at home until we bring you back for outpatient physiotherapy. So we do try to get you home as quick as possible. It's not because we get paid by the bums on the beds. It's because hospital's full of sick people and we don't want to give you anything that you didn't come in with. It's also, hospital's not an easy place to sleep. If you're having your surgery here at Whangarei Hospital, the helicopter pad is directly above the orthopaedic ward, so if it comes in at 2 o'clock in the morning, unfortunately you're going to be waking up. Dinner's also at 5 o'clock. If you don't normally have dinner at 5 o'clock, unfortunately in hospital you do. And also hospital beds aren't that comfortable. So your home bed is going to be much more comfortable for your rehab. I mentioned outpatient physiotherapy. So for a hip joint replacement, that happens about 3 weeks after you're discharged. And that'll be sort of whichever hospital you're closest to. So if you're a Whangarei local, you'll come here to Whangarei Hospital to have your outpatient physio. If you live closer to Dargaville, the Bay of Islands or Kaitaia, you'll have your outpatient physiotherapy there. Before we do discharge you, however, we do make sure that you are going to be able to manage at home, that you're independent with your walking, you can get in and out of bed, and as we said, up and down the stairs. It is important, however, just to try and organise a chauffeur now for your appointments and your following rehab, as you won't be able to drive to these appointments. I've got some top tips for sort of coming into hospital. The first one is please don't bring in any brand new clothes or clothes that you aren't afraid to throw out. Quite often the wounds ooze a little bit after the operation, so it's quite good just to have some old loose fitting clothes that you can easily get on and off. The next one is please do not bring any jandals into hospital with you. Trying to walk with jandals, crutches and then go up and down stairs is a bit of a nightmare. So what I'd recommend is bring in some nice trainers or slip-on shoes that aren't going to fall off. It's not uncommon after your surgery for your foot to swell a little bit, so don't bring in anything that's too tight already. Then the third tip is the one that's quite often forgotten, is bring in a water bottle. So what often happens in hospital is your water's given to you in a jug, then you've got a little cup to pour yourself a glass of water in, but the nature of the hospital beds is you sort of end up down here like this. So you're trying to pour into a little cup, you end up wearing half of your water. So bringing in a water bottle is a really good idea. All right. So at the start I also mentioned that there was 3 exercises that I'd like you to start doing now before your operation. So I'm going to show you how to do them. If you can imagine that I'm sitting in a bed, we want your legs out in front of you, and what we want to do is be pointing our toes as far away from us as we can and then bringing them back up towards our head, and we just call that an ankle pump. So it's moving your toes forward and back. All right. The second one is we want to try and tighten these front muscles of your thigh and try and push your knee down into the bed. So I'm going to exaggerate it a little bit, but it's going to look something like this. So tightening these muscles and pushing your leg down into the bed. And then the third one's a little bit hard to get on camera, but I want you to try and squeeze your bottom muscles together and hold them for 3 seconds. You can do this one in bed or sitting on the couch. So tightening your bum muscles, holding for 3 seconds, and then relaxing. All right. Now, with a hip operation, there's also 3 things that we're going to try and avoid for the first 6 weeks. So there's 3 precautions. What these are, and if I stand up to show you, what we want to do is we're not going to be able to cross our legs. So no crossing your legs, that includes forwards or backwards. What we want to also do is avoid any pivoting So we don't want our operated leg to be on the floor while we're turning. And then the last one is when you are sitting down, and this one catches a few people out, particularly on couches, but when you're sitting down, we want your knee to be below your hip. So if I turn to the side, we don't want your knee higher than this. So it always has to be lower. You don't want this. So it's quite a good idea before your operation just to have a look at how your knee is in relation to your hip on your couch, and then we can have a chat with the occupational therapist after your surgery to raise it up a little bit. So there's numerous ways you can walk with crutches, but this is the one that I've found that most people like. So for demonstration purposes, I'm going to have my left leg that's been operated on. How we're going to start walking is we want to put both crutches forward, and you want them to be about a normal step in front of you and about shoulder width apart. You always want to step forward with your operated leg first. So in this case, it's going to be my left leg. And you want to try and do the heel-toe action that you normally would when you're walking. Then you've got two different choices here. You can either bring your foot to the crutches or you can step through the crutches. But it's always crutches, operated leg, non-operated leg. So when it comes to turning around, what you want to try and imagine is that you're a bit of a penguin. So we don't want to be doing any twisting on our new limbs. So how penguins turn is they do little bits and small steps around. It doesn't matter which way you go. It's going to be small movements and moving your feet. You want to imagine that your shoulders are pointing in the same direction as your feet the whole time. When it comes to sitting down on a chair, what we recommend is, because lots of things are on wheels in hospital, is reversing up to whatever you're going to sit on. Give it a bit of a push with your leg just to make sure that it's not going anywhere. When you do sit down, please don't sit down like this, because we're going to end up doing a shoulder operation on you sooner or later. How we like you to sit down is give it a test. Once you've got your balance, take your hands out of your crutches. You can pop them into a bit of an H pattern like this, and then it doesn't matter which hand you hold them in, whether it's your left hand or your right hand, it's all personal preference. What I like to tell people is to kick out their operated leg a little bit, so just pop it in front. And generally your chair will have a handrail on it, just something else to grip on, but reaching back for your chair and down you come. Making yourself nice and comfortable. Getting up is the exact same. Hold your crutches in an H, pop your operated leg out in front of you just a little bit, pushing up with your other hand and coming up. Once you've got your balance, hands go in your crutches, and away you go. All right. That concludes the physio talk for Joint Camp. We wish you all the best with your surgery. If you're having your operation here at Whangarei Hospital, I'll see you on the ward. Otherwise, all the best with your surgeries.
Hello, my name is Holly. I am one of the occupational therapists who works here in Whangarei Hospital. Today we are going to be looking and talking through some of the things that you will need when you have your hip joint replacement. This is going to include equipment, some instructions and things to think about, and we're also going to be going through some exercises and some tips and tricks. I'm going to move through this content step by step. Please feel free to pause or rewind the video if you didn't catch it the first time to make sure you really understand all of the information I want to convey today. We're going to start with going through the hip joint precautions that you're going to be needing to keep after your hip joint surgery is completed. These precautions mean that the hip joint stays safe during the period of healing, and normally you need to maintain these precautions for 6 to 8 weeks. So, precaution number 1 we want you to think about is not crossing your legs. If I've had a hip joint done here and we're crossing the legs, that's putting strain on where the wound is and where the surgery's been done, and you're more likely to put that hip joint at risk. We also want you to think about twisting. If you're twisting at the waist or twisting your leg around, that's also going to be putting strain. So we don't want you crossing your legs or twisting your legs. We also want you to avoid a 90-degree angle. So if you think about your hip joint, it can normally go up quite high. This is a 90-degree angle. However, after your hip joint surgery, this will put your joint at risk. So instead, we want you to try and keep your angle below that 90-degree point. Thinking about that, that's going to mean that you're not going to be allowed to bend for 6 weeks. And the way to remember that is hands not past your knees. You're also not going to want to bring your knees above your hips for the 6 to 8 weeks. And that means you're going to have to think about the heights of things. To start with, we're going to talk about getting in and out of bed and your bed at home. So when you have had your surgery, you will need to have certain strengths and skills already to be able to get in and out of bed correctly. That's going to mean that you'll need to do some exercises now, before your surgery, so that you are strong enough to use this technique to get in and out of bed. So every morning and every night when you're lying in bed, we recommend that you practice these 2 different exercises. Exercise number 1 is lying flat on your back with your legs raised. You might need to extend the sore leg a little bit out. It might not be comfortable to have it all the way, but just making sure you're as comfortable as you can be. Placing your hands flat on the mattress beside you, we want you to raise your hips towards the ceiling and then bring them back down. This exercise is called bridging, and what it does is it strengthens your leg muscles, it strengthens your core muscles, and it strengthens your back muscles. And it means that after surgery, you can get in and out of your bed safely. The way to get in and out of bed safely is to first assume this bridging position, move your hips across the bed towards the edge, and once you've done that, dropping your legs below the edge of the bed, maintaining that low 90-degree angle, and then practicing sitting up. That incorporates the second exercise that we need you to be practicing, which is the sitting up. We want you to be practicing doing sit-ups at home. Now, we know that sit-ups aren't the easiest exercise, and so even if you can't manage your basic all-the-way sit-up, we recommend that you practice at least tightening your core muscles so that it will one day be easier for you to get out of bed. Maintaining that less than 90-degree angle until you can come around and sit up. We also want you to be thinking about the height of your bed. If at home, when you sit down on your bed, your knees are above your hips, it's quite likely that your bed might be too low. If that's the case, it's something to discuss with your occupational therapist, as they can help you find ways to make your bed higher if need be.
Okay, where are you going?
So after thinking about the height of your bed, you also need to think about what chairs you have available at home. Number 1, we want you to consider if you use a lazy boy. If you do, you're probably not going to be allowed to use it for that 6 to 8 week period post having your surgery done. The reason for that is lazy boys tilt your hips back, which will break that 90-degree precaution. And as you shuffle forward to stand up from a lazy boy, many of them dip down, meaning that your height off the ground will be too low and your knees will rise above your hips. Instead, we want you to find a chair a little bit like this one. Something that has arms to push up from and is an appropriate height, and when you sit on it, your knees are below your hips. This is a hip chair. It is available as part of the equipment package we can give out from the occupational therapy department. It is height adjustable, it has arms to push up from, and it's well padded. It is something that can be available to you if you don't already have an appropriate chair at home. Once you've found an appropriate chair, you have to consider how to get in and out of it well. To do that, you're wanting to make sure that if you're approaching to sit down on a chair, and this goes for sitting down on any surface, including your bed, the toilet, or the shower stool, we want you to think about not twisting, because that's going to be twisting at the hips and that's one of your precautions you're not allowed to break. Instead, you're going to need your crutches. You're going to back up until you feel the back of the chair behind you, bringing your crutches round, reaching back, again, not twisting to look, but instead reaching, putting your hands back, sitting down, perhaps easing your sore leg out if you need to. And that's how it is. To stand up, it's a reverse of the process really. You're going to put weight through the arms of the chair, weight through your good leg, bringing yourself up, pulling your crutches around, and away you go. After you've thought about your favourite chair, we then need to start thinking about the toilet. Most toilets are about 40 centimetres high, which is often too low after you've had a hip joint surgery and will mean that you can't maintain that 90-degree angle. Instead, we recommend having something to make your toilet higher, and the occupational therapy team can provide some equipment to help with this. We normally recommend that you go for one of our over toilet frames, which looks like this. It has height adjustable legs, a toilet seat, and a splash guard just to make sure everything goes where it should. To install, you simply lift the seat of your toilet and place this over the top. It then provides you with the correct height once you've adjusted it, and arms to push up and down from. All right, thinking about if you need one of those. Some New Zealand homes have quite narrow bathrooms and we're aware this doesn't always fit. Or you might already have rails in place at home and feel you don't need the arms to push up from. If that's the case, we might be able to instead provide you with a raised toilet seat, which looks like this. The raised toilet seat can clip on to the top of the porcelain edge of your toilet. It screws into place so it's nice and sturdy and tight, and then provides you with some extra height. We can go up 2 inches or the 4-inch, which is this size here. If this is the option you choose, make sure your toilet's the same shape, as we only do one shape of these, and if you have a square toilet or a different shaped toilet, it may not fit. This is why we tend to go for the over toilet frame first. Once you've thought about toileting, you probably need to start thinking about what's next door, which is the shower. If you have a shower over the bath, again, it's the same way as the lazy boy. Getting in and out of a shower over the bath means you're going to have to lift your leg potentially past that 90-degree angle to step in. Or if we gave you some kind of equipment that would bridge it, you would have to sit too low to actually get in and out. So normally we recommend if you have a shower over the bath at home, you find a family member's home that has a shower unit instead, or you sponge wash for 6 to 8 weeks. The equipment we provide for showering is a shower stool. It looks like this. This piece of equipment is reasonably vital as it's likely your shower will be slippery and you will be reasonably unsteady after your surgery, so you want to stay safe in that area. Shower stools have arms to push up from and height adjustable legs. They are very useful because it means once you're in sitting, you'll be able to do more from a washing perspective. Although remembering when you're washing and drying and even getting dressed, you aren't allowed to bend or put your hands past your knees to maintain that less than 90-degree angle. If that's the case, you're going to have to start thinking about how you're going to do your washing, your drying, and your dressing below your knees. Next, I'm going to demonstrate some tips, tricks, and pieces of equipment that can help with that. So now I'm going to demonstrate some ways to wash, dry, and dress your lower body after having a hip joint surgery and maintaining your hip precautions. Number one, when you're thinking about washing and hands aren't allowed past your knees, you're going to need to think about how you're going to wash that lower area. Now, some of you might be fine just to take the shower head off and give it a bit of a squirt below. Some of you might have precautions that mean you need to actually wash very carefully between your toes and things like that. Keeping that in mind, there are some options that you can purchase either from different places like the warehouse or different other places like that, or from our occupational therapy department here in Whangarei Hospital. We recommend you get some kind of long-handled aid, whether that's a sponge or some kind of brush, so that you can get down and wash. Making sure you're not leaning too far forward, as that may break that 90-degree hip joint precaution. Instead, washing like this and getting down to wash your legs. You might also want to look at purchasing a toe washer, which looks like this. Again, you can purchase from our occupational therapy department or maybe chemist or somewhere else. And this can just help you wash between your toes and get in and dry as well in between those areas that are difficult. Once you've done that, getting dry is reasonably simple. You can either dry off your brush or your sponge, wrap it in a towel and dry that way, or you can use your toe dryer, or you can use your Easy Reach. This is a very important piece of equipment that we issue after you've had your hip joint surgery, and you can use this. You can grab a towel, wrap it around, use it to dry. You can also use it to dress your lower body. So, getting dressed, once you're all nice and dry, we recommend you sit to get dressed, whether that's on the edge of your bed or on your shower stool that's been taken out and dried. We then recommend you get yourself whatever you're going to be dressed in for the day, placing that just quite simply on the floor and using your Easy Reach, like so. You're going to grab that, dressing the sore affected leg that you've had your surgery on first. You're going to ease your foot over, bringing it up to your knees where you're allowed to reach to. You might be able to bring your other leg up and guide it in, but if that's too difficult, you can then use the other side to help your other foot in. Moving it up to your knees. Once you're up to your knees and your feet are free, you can put your Easy Reach down, standing up the way that we talked about earlier on, and pull it the rest of the way up. For getting them off, you're going to want to do the same in reverse, easing it down to your knees. You might be able to just let it drop, or you might need to sit down, and then using your Easy Reach, ease your pants all the way down, and using your Easy Reach to pick them up. Easy Reaches are great for picking up anything you drop on the floor, and that's why we tend to give you one, as you're not allowed to bend and pick something up off the floor for at least that 6 to 8 week period. Once you've got your pants on, you may want to put a sock on, especially in winter months. You can purchase from our occupational therapy department a sock aid that looks like this. It has long strings and it's just a curvy piece of plastic. Popping that between your knees, you're going to get your sock and guide it over the top. You're wanting to aim to get your sock nice and gathered up at the top there so that it's ready to go over, making sure it's all the way tight on the toe. Popping your sock aid on the ground, wiggling your foot through until your toes are all the way to the toes of the sock, and then simply guiding the sock up your foot. Just like that. Once you've got your socks on, you may want to get your socks off. To do that, you can simply rub your socked foot across some carpet and it may come off, or you can use your Easy Reach to help guide it off your foot and pick it up. Easy enough. You might also want to invest in a shoe horn, which will help you get your shoes on and off without having to bend too far down. If you need to have your bed raised or your favourite chair made higher, there are some options to do that. For your bed, we can get big wooden spreaders that can raise it, or we can raise it using elephant feet, which look like this, and the leg of your bed or your chair just slots into the top there and that can raise it. One elephant foot for each leg or of your chair or your bed. We can also get chair raisers, which can raise some armchairs, but again, we wouldn't be raising your lazy boy as it's likely not to be a safe option. So if you are thinking you need something in your house raised, please discuss that with the occupational therapist and they'll see if they can provide you an appropriate option to raise that piece of furniture for you. Now that you know that you are likely to have a surgery in the next little while, it's reasonably wise to start thinking about what equipment you might need so that when you get in touch with the occupational therapists, you can have that discussion reasonably easily. It's also good to start thinking about your home environment. What trip hazards might be there? Do you have any loose mats that you need to roll up and move? Do you have any tables that might mean that you might knock into them if you're walking around with a pair of crutches? Have you got an enthusiastic pet that you might need to maybe keep calm or keep away when you first come home so they're not going to be in between your legs? Do you need to maybe warn some of the children that you might have at home that you're going to be walking around on crutches and maybe don't need them running too fast beside you or running up for hugs? Thinking about the heights of things and where you keep things that you need to access every day. Is your favourite mug kept in a cupboard on the bottom shelf and now you're not allowed to bend? It might be wise to start thinking about bringing the things you need to access daily into places that are between the height of your eyes and the height of your waist so that you can actually reach them easily. Move the microwave off the top of the fridge. Getting hot soup out while you're unsteady with crutches, you've got to start thinking about the easiest place for things to be in your home. Start thinking about what kind of clothes you're going to wear for that 6 to 8 weeks. Are you going to need to have shoes that have Velcro instead of laces? Are you going to need to consider the easiest clothes to put on with an easy reach? Start thinking about having some meals frozen and put away in the freezer so that if you don't feel like cooking that night, you're in a bit of pain after surgery, you've got an easy option. Organise someone to be ready to come pick you up after you're ready to go home from the ward. That way you will have somebody else who can drive, as you won't be able to drive for the initial period after you've had your surgery done. Making sure you have someone there when you go home, so someone to stay overnight and make sure you have what you need for that first 24 to 72 hours. It's really important to start thinking about these things ahead of time. Planning ahead means that your journey will go smoother on the other end. Finally, I want to talk through getting in and out of a car, as this can be something that a lot of people have questions about. First, when you have your person or your driver who comes to pick you up, get them to park away from the curb. Parking away from the curb means that you have more room to get in and out of the car, and the height of the car isn't affected by the curb being higher. It doesn't change your levels. Once you've done that, opening the passenger side door in the front. Once you've got your door open, rolling the window down, as that'll give you an extra thing to hang on to, and looking to place some form of plastic bag on the seat. Plastic rubbish bag or something else that is slippery, placed on the seat of the car. Once you've done that, you've got your door open, you've got your crutches, you're going to have the person who's driving you home standing there ready to assist, carefully backing up until you can feel the car at the back of your legs, handing your crutches to the person who's driving, holding on and holding on, leg out that's sore perhaps, and easing yourself down. Once you've eased yourself down, you want to make sure that in the car you've pushed the seat of the car all the way back and the back of the car seat is leaning all the way back. This is going to help with getting in and out of the car because it's going to mean you're going to be able to lean back a little bit like when you get in and out of bed, swivel yourself round and bring yourself into the car. Once you're in the car, you can bring the head of the chair up a little bit, bridge a little and remove the bag. That's going to make sure you don't go sliding when somebody brakes, and then you can drive home. Once you're at home, raising yourself up so the plastic bag can go back underneath. Once it's back underneath, same process, putting the back of your chair back, easing yourself out, making sure that that 90-degree angle is kept safe. Once you're sitting on the edge, it's the same process, taking your crutches, pushing to stand up, and away you go. That is all that we recommend from us as an occupational therapy team after you've had your hip joint surgery. The best next step for you now is to get in touch with your local occupational therapy department. There's one in Kaitaia, Kawakawa and Whangarei, as well as Dargaville. And once you're in touch with them, asking to speak to an occupational therapist about organising equipment for pickup. We can organise equipment for pickup from any of our regional hospitals, and you can drop them back off to any of our regional hospitals. The main Whangarei line, if you want to call us, is 09 430 4100, extension 7425. or you can call 0800 4 OT SLT.
Kia ora. Welcome to Joint Camp. My name's Jo Garnett and I'm an orthopaedic social worker on Ward 1 at Whangarei Hospital. When you come in for your surgery on about day 1 or day 2, one of the social workers will come onto the ward and see you. They'll discuss with you what sorts of supports and cares you currently have around you in your life at the moment that you can utilise when you're discharged home. And we can also discuss other options of the possibility of formal supports if you fit the criteria. The NAS team at Whangarei Hospital could possibly set up formal supports for you. This is when an agency sends a carer into your home and can provide personal cares such as showering supervision, showering assistance, changing and set up for the day. This is an hour a visit and could be about 3 times a week. Best to utilise this on alternate days. In more difficult circumstances, you could get up to 7 times a week, or even discuss a respite option. The criteria for these home supports through the DHB are that you might maybe live alone, or the person that you live with is limited in their ability to support and help you at home when you get home, or your loved ones don't live nearby or locally. Something else that may be a good support for you to consider is the NTA scheme, the National Travel Assistance Scheme. You could possibly, under the scheme, if you fit the criteria, get reimbursed for petrol costs. So if you're travelling 80 kilometres or more one way to or from the hospital and you've got a community services card, or you're travelling 50 kilometres or more one way and you've had at least 6 specialist visits in the last 6 months, or if you don't have a community services card, 350 kilometres one way. Something else that may support you through the NTA scheme is possibly having some support people come along with you and may get their accommodation costs paid. The criteria for this under NTA is 100 kilometres or more one way. We have accommodation here on the hospital grounds nearby. We've got the whānau house, which is $10 a night for a single room if you don't fall under NTA, or there's the Pukawakawa Lodge, which is $85 to $95 a night if you don't fall under the NTA scheme. There are other things that social workers may be able to discuss with you on the ward. One of these is whether you're thinking about applying for something through the MSD or working income, such as a disability allowance, a St John's alarm, or even income or benefit support. We can discuss with you and give advice around applications and how to apply. And something else to consider is total mobility parking. This is usually applied for through your GP. But if you do get to the hospital after your surgery and you do want to discuss this, we could organise an application form for you and support you in applying. Please discuss any of these things with us on the ward if you have any questions. If your surgery is in Kensington Hospital, there is a registered nurse there to support you with any of these things I've discussed on this area of the Joint Camp video. If your surgery is at Kaitaia Hospital, there is a social worker there. Other tips for your discharge planning from the social workers. Do you have someone to stay with you overnight for the first 2 weeks that you're discharged home from your elective surgery? This will support in your recovery. Your main supports need to come from your loved ones, from your family and friends. Formal supports are limited. Something else to put in place is a transport plan. Who's going to bring you to the hospital and home again? And if you have any outpatient appointments, who can get you there and home again? Also, are there things you might need at the pharmacy or the supermarket? Do you have someone to pick those up for you? Are you the primary caregiver for someone in your life? Do you look after a child? Or are you the primary caregiver for a loved one or a partner? Put a plan in place. Who can step in and be the caregiver for this person whilst you're recovering? One last important tip. Do you currently have formal supports already in place? If so, call the agency and let them know that you'll be coming into hospital, and pause those supports until you're home again. If you have any questions at all regarding this area of the joint camp video, or if you would actually like to organise something before you come in to the ward, please don't hesitate to give Whangarei Hospital a call and ask for one of the social workers.